certain amount of hours in a very hard floor, and my meniscus on my right leg was completely, really bad, you know. When I came back to McAllen, I told Jesus about it, and I did not even know USANA. We are talking about, this is 2019, okay? And I didn't know anything about USANA. I knew about supplements, but I didn't know about USANA. Well, I went to see a specialist because I knew that my meniscus, something, I didn't have a ligament trouble, but I know I didn't feel any pops or anything, so I knew that I had a problem seriously on my knee because of the swelling, the pain, the inability to walk properly, and all of that stuff. And here I am suffering. You know, I couldn't dance, and I was complaining, and Jesus was just looking at me. And I was like, you know, I'm tired, and I did not know his son. I didn't even know what Jesus did, actually.
She throws me under the bus every single time she
It is true. We were dating, but I mean,
that was that belief challenge.
you know, the problem is that, you know, I have my own life, I have my own things. I really don't need to know what he does, as long as he's not a thief or a criminal, you know. You know, so then I was like, look, I had, seriously guys, I had to inject my knee myself, okay? Every 3 to 4 days to be able to stand and see my patients. My practice is very busy. I see between 30 and 40 patients a day. I'm running all the time. I do procedures. It was a hell on earth until Jesus reluctantly came to me and said, Maria, how are you? Are you open-minded? I was like, what do you mean open-minded? He says, you know, because maybe I can help you. He says, how you can help me? Because I already went to a specialist. They told me that I need surgery, you know, on my knee, but that's the problem with doctors, you know, because, you know, I learned, not from my own experience, but doctors should give options to their patients, you know. An option of not doing nothing, it's an option, you know. We are humans. I can decide I don't want to suffer, right? So, but anyway, at that time, the option that was more the fastest and supposedly the fastest and the better, it couldn't be done because of other health challenges that I had, and now you explain, okay? So, Jesus reluctantly started talking to me about USANA, you know? And I was like, yeah, why didn't you tell me this before? Right? So then I was like, okay, where is this? Well, why didn't you? Well, so then I start reading about the protocols, reading about everything. It says, okay, can you order? Okay, but you know, it says, no, I wanted the biggest protocol. I want to be fine because I was done with the suffering. Anyway, finally, you know, he was not a believer. You know, he says, well, we may help you, we may not, you know, we are being the business.
She really had to pull it out of me.
I had, because, you know, I suffered for almost 6 months, okay? And he says that it was not 6 months, but it was. Because I remember going to Brazil in May, and that happened
Still
to me.
maintain it was 2 to 4 weeks.
No. I remember because we were around Thanksgiving when he mentioned the USANA to me, okay? So I remember perfectly my suffering. And, you know, finally after he told me, you know, I said, okay, let's go now order. And then I ordered it, and these I was, remember, injecting my knee with anesthesia. I had already done 2 injections of steroid. It didn't work, which the doctor told me, the specialist, that it would not work. And when I started taking the products, Jesus was not believing at all. I look at the size of the pills and I said, what? You're telling me that I'm gonna have to take this? Then that's when I realized that I had other problems, you know, because I did have diverticulitis and I had other problems that were not helping me to absorb the products properly. So anyway, I will tell you one thing. From a day that I was injecting my knee like 2-3 times a week, the first week that I started taking the USANA, I don't remember injecting my knee. I don't remember, okay, injecting my knee. So then Jesus was like, ay Maria, por favor. Really? I was like, Jesus, I'm gonna tell you, you know, I didn't inject my knee this week. My pain is tolerable because I was living with a pain of 8 to 10, like we classify, right? So if I had any pain, which I don't recall, after the first 7 to 10 days I was taking, it was not very much noticeable to me. Okay. After 3 weeks I was taking the product, 3 weeks, okay? There was an event of dancing, you know, because I was going to dancing like, you know, I could barely walk. We went to the events, I danced the whole night. I did, 3 weeks. I had some pain after, but it was not intolerable, okay? And I was like, Jesus Maria, no es posible, be careful with your knee. Well, anyway, I continued taking the products, okay? So after that, I said, hey, I think I need help with other issues. Let's gonna see if I can do, if you can help me with my diverticulosis. You know, I do have, we all gonna have it. I mean, I don't know how many people here in this room, but I can tell you one thing. Maybe 2 or 3 don't have what is diverticulitis, okay? It's an aging degenerative disease also. It's like